Hello everyone and welcome back to my channel. Today we'll be solving an audiology quiz about tympanometry. Are you ready? Let's get started. Question 1. These are statements related to tympanometry. Decide whether each statement is true or false. A 226 Hz probe tone is the standard frequency used for tympanometry in adults. This statement is true. A 226 Hz probe tone is the standard for adults because their middle ear system is sufficiently stiff, allowing for accurate compliance measurements. B. A 1000 Hz probe tone is more reliable than a 226 Hz probe tone for tympanometry in infants under 6 months old. This statement is true. In infants under 6 months, the 1000 Hz probe tone is preferred because their middle ear system is more compliant, making the standard 226 Hz tone unreliable. C. A type A tympanogram always indicates normal hearing. This statement is false. A type A tympanogram only confirms normal middle ear function, but does not guarantee normal hearing. A patient with sensorineural hearing loss can still have a type A tympanogram. D. The normal criteria for tympanometry are the same for adults and children. This statement is false. Tympanometric values differ between adults and children because of anatomical differences in the ear. Ear canal volume, static compliance, and tympanometric peak pressure all have different normative values based on age. Next, question 2. 1. The correct match for type A is normal middle ear function. A type A tympanogram shows a well-defined peak around 0 dpa, meaning the tympanic membrane and middle ear system are functioning normally. This is the expected result in a person with no middle ear pathology. 2. We have type AS, which is associated with otosclerosis. A type AS tympanogram looks similar to type A, but with a reduced peak, indicating stiffness in the middle ear system. This is commonly seen in otosclerosis, a condition where abnormal bone growth restricts the movement of the stapes bone, leading to conductive hearing loss. 3. For type AD, the correct match is ossicular discontinuity. A type AD tympanogram shows an exaggerated peak, meaning the tympanic membrane moves more than normal. This typically occurs when the ossicles are disconnected or hypermobile, which can be caused by trauma, congenital defects, or chronic ear disease. 4. A type B tympanogram is flat, which means the tympanic membrane is not moving as expected. This can be due to fluid in the middle ear, commonly seen in otitis media with effusion, or a perforated tympanic membrane. How do we tell the difference? By checking the ear canal volume. If ECV is normal or small, it suggests fluid in the middle ear. If ECV is large, it indicates a perforated eardrum or an open pressure equalization tube. 5. Finally, we have type C, which is associated with eustachian tube dysfunction. A type C tympanogram has a negative peak, meaning the middle ear pressure is too low. This happens when the eustachian tube fails to equalize pressure properly, which can occur due to allergies, colds, or after an ear infection. It is often seen in the early or late stages of otitis media. Next, question 3. Arrange tympanograms in the correct order during the recovery process from otitis media with effusion. Let's analyze the tympanograms and find the correct sequence. We have 3 tympanograms labeled A, B, and C. Each represents a different stage of middle ear function during recovery. Let's go through them one by one. Type B, acute stage. A flat tympanogram indicates that the tympanic membrane is not moving properly. This is characteristic of middle ear effusion, where fluid fills the middle ear space, preventing normal movement. This stage represents acute otitis media with effusion. Type C, recovery. Stage: a negative peak at negative 150 decapascals or lower suggests that the middle ear is recovering, but the eustachian tube is still not functioning normally. The fluid is starting to clear, but negative pressure remains, leading to a type C tympanogram. Type A: full recovery. A type A tympanogram means that middle ear pressure has normalized, and the tympanic membrane is moving as expected. This represents complete recovery from otitis media. The correct sequence is B to C to A. Question 4. Why are children more prone to otitis media? The correct answer is C. Their eustachian tube is shorter, more horizontal, and less efficient. In young children, the eustachian tube is shorter, more horizontal, and narrower than in adults. Because of this anatomy, it is less effective at draining fluid and equalizing pressure in the middle ear. This makes it easier for bacteria and viruses to travel from the nose and throat to the middle ear, leading to frequent ear infections. If you enjoyed this video, don't forget to like, subscribe, and hit the notification bell so you don't miss future audiology quiz explanations. Thanks for watching, and I'll see you in the next one. Bye.